This episode of The Benefit Whisper is brought to you by Route 3 Insurance and Financial Services, where smarter benefits begin. If you're tired of rising healthcare costs and opaque insurance contracts, Route 3 is here to help you take control. They specialize in transparent, employer-driven benefit strategies that protect your people and your bottom line. Ready to break away from the status quo? Visit www.fixmybenefitsnow.com and discover how Route 3 can help you build a plan that actually works for your team and for your budget. Welcome back to The Benefit Whisper. I'm your host, Ralph Weber. And, as I always say, group benefits are more than just numbers on a spreadsheet. They're a tool for attracting and keeping great people, protecting your team, and securing your business's future. But too often, benefits are sold like a commodity, leaving real savings and smarter strategies on the table. Today, we are continuing a great topic that should make every employer stop and think. Trust. Trust your vendors, trust your contract, trust your data, and even trust between employers and employees, which we discussed in the last episode. And again, joining me today, we have an amazing guest. We're so much aligned on so many things. Ann Lewandowski, one of the sharpest minds in healthcare operations and compliance, and has spent years helping employers uncover what's really in their vendor contract and what's not in those contracts. She's been frustrated by, things that have happened to employers, to herself. She's seen firsthand how misplaced trust can cost employers money and data and credibility. And it is great to have you here again. Welcome back to the show.
It's so great to be here. Thank you so much for having me, Ralph.
Yeah, and we have so much to talk about. Let's dive right in and let's speak about data.
Well, I think we have a date with the data. So let's talk about our data.
Okay.
And that immediately gives me a flash to data on Star Trek.
Right.
And, sort of this AI world that we live in is so interesting. So one of my beautiful partnerships after leaving corporate America was to join with my brilliant partner, Steve Chamberlain. And everybody knows I like to joke that Steve makes my data dreams come true, because I know that in healthcare, at least, you really have to have data in order to back up a lot of decisions. I think that is a core principle that I've seen over my years and years in healthcare. And I think that's a real opportunity for corporate America and benefits decision makers to recognize that you can really make different decisions when they're informed by data.
Absolutely. I was talking earlier about my background as an air traffic controller, heavily data-driven, heavily. I remember even the entrance exam talked about it, put all different aircraft with all different points. Here's where they're going. Here's how fast they're climbing. Here's their altitude. Here's their wind speed. Here's their airspeed. Here are the winds. Here where they're coming from. Keeping 50 aircraft from hitting each other and keeping them safe when they can't see a thing is very important. But the same holds true in healthcare contracts, visualizing all these moving pieces at the same time. And as I was telling you earlier, it really led a lot to what I do now. And it's, a lot of those capabilities are the same.
So I love that analogy. As you were describing these 50 different air traffic, I was thinking about all of the pieces of many employee benefits plans, right? So it's so funny when you have somebody who can just pull an idea out of your mind and be like, give it such a great visual. I'm thinking of your PBM, your wellness plan, your TPA, all of some of these bolt-on add-on solutions. And how on earth are you supposed to keep them sort of straight in your mind without data?
No, exactly. Exactly. And that, your broker consultant should be that person that knows all of the moving pieces and that knows how they contribute. Some drugs are covered under your PBM. Some hospital infused drugs are covered by your medical plan. Those are two kind of different moving pieces. Understanding them all and understanding how they interact. As I said, if the wind's coming from 330 at, 75 knots, that's going to change your outcome where you get to. I guess it's a great talent to have. I lean on it all the time.
So what we like to do is actually give data visualizations. One of Steve's amazing skills that I'm actually learning to do, fun fact, is I'm in data camp It's learning how to do SQL and Python so I can help contribute in a different way. But really, what we've done is we've created really easy to read dashboards so that executives can understand exactly where their health spend is, specifically how their pharmacy spend is acting. And then one of the really exciting things for us was to get natural language processing
Yes.
and an AI assistant. So you can start to ask it questions. Now, actually, this brings up some really important governance issues for
Hmm.
plans, which is how is AI and machine learning being used in your health plan? So, one thing I'm actually speaking at the Houston Business Group on Health later this year. One of the things I'm going to be covering is there are specific healthcare regulations around AI popping up across the states.
Hmm.
And there are general privacy rules that are similar to the European General Privacy Rule and Convention,
Hmm.
sort of led by the California Privacy Act and Consumer Privacy Act. That's the other C, California Consumer Privacy Act. And what that actually has is rules around people being able to opt out of automated decision making. And so, yeah, do you
Wow.
see where we're going
Yeah,
here?
yeah, yeah, yeah. Absolutely.
So, as a plan sponsor, you may be responsible for people being opted into a TPA's automated decision
Hmm.
when they've opted out under the California rule.
Wow.
Now,
Okay.
often we talk about plans, self insured plans being covered under ERISA, and most of these state laws being preemptive.
Right.
One of the challenges of these broadly applicable bills and why ERISA would probably preempt the healthcare AI issue, but it does not preempt broadly applicable bills like a privacy rule.
Right.
So that's a fun upcoming battle that I think plan
Yeah.
sponsors can think about. Ralph, another really interesting thing that we should talk about is contracting with third
Hmm.
party vendors
Okay.
and what HIPAA does and doesn't cover. Are you ready to jump in?
I am ready. And you know what you just talked about as an air traffic controller, we would call that turbulence.
Yes, this is going to be great. I'm so excited that we have a really fun and probably much more accessible, although I don't
Yeah.
know how accessible air traffic control is to your audience, but I love the puns and
Yeah.
opportunity to create some analogies. So, one of the things I was reviewing on a MAPIA contract, so this very large group
Uh-huh.
had gone out to RFP. I was an expert on MAPIA, giving them advice, and the contract came back around data and data privacy. Now, what was really interesting was this was de identified data.
Hmm.
So, for people who maybe are outside, it means that the HIPAA protected domains are already stripped away. So it's data that actually could be bought and sold on the market. And so when I looked at this vendor's contract, it specifically said HIPAA data will not be bought and sold.
Hmm.
But what sometimes you look for in a contract is what's not there. And since there was not a prohibition against selling non HIPAA data, it actually meant all of the data this plan sponsor was about to give to this third party vendor could
Hmm.
be bought and sold on the internet, and the plan sponsor would have no recourse and would also not get any of that money after paying what's quite honestly a pretty hefty fee for those services.
Wow. Wow. And data is huge. It's hugely valuable to advertisers. Like last time I bought a car, I always wondered why I started getting these notices from third party warranty vendors.
Yep.
And I'm saying, well, just wait a second. I bought an extended warranty. Why are they trying to sell me something? How do they know what car I have, what year it is? So obviously, the car dealer or manufacturer has sold my data.
Yeah. So one of the things that really annoys me. So I was in what I call baby law school, getting my master's of
Hmm.
legal studies, and
Hmm.
I
Wow.
had sort of one of the preeminent data rights and privacy people as my professor. He was amazing. After going through that, one of the things that I think about every time I check out is when they ask you if that you want an emailed receipt. And I always decline no, because this is again a way to get your data and your information.
Oh,
Yeah,
interesting.
think
Interesting.
about it. Yeah.
Yeah, 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 makes
So
sense.
So like those spin and get 30% off, enter your email and get the
Hmm.
coupons
Right.
again. So in some ways, we can actually apply these same lessons
Hmm.
to what's happening in healthcare data. And that is big money.
Yeah.
So I'm actually helping a group right now as an advisor set up blockchain patient records
Hmm.
so that patients can get paid. And we've recruited in another advisor who has bought and sold this data. And this particular group had given some of their patient data away to a very, very large corporation for AI training. And I
Really?
estimated the giveaway at about $20 million. And that was an underestimate
Hmm.
according to my data sales expert. So when you're thinking about how much this data is worth, it is potentially worth millions, and it
Hmm.
can also be weaponized against you
Right.
because when your PBM and your TPA and all of this show up, right, they may actually be looking at, say, you have somebody who's pregnant and
Hmm.
they've got news. They know their child is going to need surgery. So they're, frantically searching for hospitals. Hospitals can actually sell de identified data that hits their website.
Hmm.
And so your PBM or TPA may actually be picking up that one of your employees is searching for these services and they may know it before you do. So I
Really?
like to joke, maybe I need to change my you're a one horse show showing up at a hypercar rally to you're the Wright brothers showing up at the supersonic jet rally to fit our air traffic control
Yeah.
narrative. Yeah. So I think that's where data becomes just so incredibly powerful and it's so valuable. It's one of in some ways it might even be more valuable than gold or some of these rare earth minerals.
Yeah. Oh, absolutely. And with all the international stuff and the hacker, the AI, assisted hacking, it's scary. I wrote a blog years ago about comparing identity theft to medical identity theft. And at that time, I had data which indicated that regular identity theft is worth $1.50 a name or a hit or a social, but medical is worth $50.
Yeah.
So it was that big of a difference. This was, like I said, going back 15 years. So that's very interesting. Now, of course, a lot of people think that HIPAA covers them because it's the health information privacy and protection. So isn't it giving us privacy and protecting us? And you and I both know it's not, but why don't you tell our listeners a little bit more about that? How it protects you, how it doesn't.
Yes, so HIPAA covers, and I need to look up the exact number of domains because I always get it wrong. Um, I think it's 26 HIPAA domains. Let's do a really quick Google search. And it's it's not coming up quickly. So there are certain types of information. So your
Hmm.
sex, your age, your name, your address, these things that actually, when you're called or
Hmm.
checking into healthcare, they verify.
Right.
Like, what is your address? What is your last name? What is your date of birth? What was really interesting to me in my data privacy class was learning just how much is not covered. So there's this concept of, quote, de identifying, which I think you can argue in the age of AI doesn't exist anymore,
Hmm.
but HIPAA hasn't caught up because it was passed in
Right.
1996. So one of the things I did some in depth research about was actually genetics.
Mhm.
And so, of course, plan sponsors have to comply with GINA, which means that you can't make adverse benefit decisions based on people's genetic information. But if you, quote, de identify a patient chart like mine, I have no doubt that my patient chart has been sold. I did a full genetic screen in 2015 just to make sure before I got pregnant that anything was, nothing bad was going to happen or, prediction. If they strip away my name, age, address, or location and a few other things, they
Mhm.
can actually sell that. And so that when I talk about the contract that this plan sponsor was entering into with their data,
Mhm.
it actually means that once you strip away those pieces, your vendors can sell it. And so that's where, as much as we like to think we have health information privacy, it's
Mhm.
an extremely limited law, which is why some of these other states have passed more general privacy laws.
Sure, absolutely. And as you mentioned, it's 1996. It was a long time ago. And the world has changed since then in the
Yeah.
last 29 years. Yeah,
Yeah, my
exactly.
professor pointed out we hadn't even really started in a real way the whole genome project, so nobody could understand, or even MRIs being the way they are. AI was science fiction,
Yeah,
and
exactly.
we wouldn't have even imagined that. So it's a wild world out there, and data sales and use is still a little bit of the Wild West and an area for plan sponsors to be really cautious with, I think.
Yeah, absolutely. Is there any specific, contract clauses that they should be looking for, red flag phrases or anything like that?
Yeah, so I think how long the vendor gets to hang on to your data is a huge one. This
Mhm.
particular vendor wanted to hang on to the data for 3 years. I
Wow.
said it needed to be deleted as soon as the project was completed.
Mhm.
And because you can always request the data again, I don't like data hanging out for many years
Sure.
because I think it also poses a risk of compromise and data breaches. I think
Mhm.
also looking at the data breach language, what and when and whom needs to notify the employees when that
Right,
happens. And I say when, not if, because it
yeah,
really is a when
right.
at this point. And then I also think, looking at what is protected. Is it plan data generally? Is it
Mhm.
HIPAA protected data?
Hmm,
Those are
okay.
very, very different things in 2025.
Yeah. No, absolutely, absolutely. So, it's definitely something to look out for. So, is there a sort of practical step they can take to review all of those contracts?
Or start opening them up and just looking and seeing, is data addressed?
Mhm.
What is considered data, what is considered your data. I think it also gets back to the gag clause attestation
Right.
required by the Consolidated Appropriations Act of 2021. Do you have access to your data? All of these questions are complex in
Yeah.
2025. That was one of the things I advised this particular plan on was you are probably attesting that you can get your data.
Mhm.
You may want to see if you can request it from your TPI rather than outsourcing that to a vendor, just so that if you were challenged on that, you could actually say, we conducted this project, we got our data, and we're good. So,
Right. Yeah. No, it's hugely important. Wow, there's so much. See, this is why you need an air traffic controller type mentality to overlook your plan.
and I think,
So, go ahead.
I would just say a lot of brokers are really good.
Mhm.
But I'm not sure, Mark Cuban talks about a sort of a fractional healthcare executive who's
Right.
independent, who can
Yes,
help with that. And I do think that that's actually very, very wise advice
I
because
agree.
most people in HR or a CFO don't have that expertise.
Of course. No, then no, absolutely. And I think even if you have a big consultant, it doesn't hurt to hire somebody outside and independent from that firm, from that carrier, et cetera, to, do some fractional consulting on that.
Yeah.
Because there's always something that can be found that is going to give you that payback for that
Yeah.
consulting. Absolutely. Wow.
And it could be, something compliance, could be,
Hmm.
employer advocate.
Hmm.
Sometimes employers get uncomfortable advocating on their own behalf. So it's easier
Right.
to kind of bring somebody else out and just sit down and be quiet.
Yeah. No,
But
absolutely.
it's not intended to be an insult to a broker, right? It's
Mhm.
really just this trust but verify opportunity that
Right,
we talked
exactly.
about in the last episode.
Yep, yep. No, absolutely, absolutely, hugely important. So there are a lot of things that can be done. How much in terms of a percentage of spending just by having the right contracts? And I had, Chris Deacon on a few weeks ago. She spoke about what happened in New Jersey, how contract language saved the state of New Jersey over $2 billion on their pharmacy spend, plus another half a billion on their healthcare over 4 or 5 years.
Yeah.
So that's just contract wording.
Yeah. Yeah. Do you get olive the pharmaceutical payments, or do you
Hmm.
only get your rebates? And if we look at the RAND RxDC report, that's a difference. The rebates passed on from as reported by PBMs is about 0.2 percent, or like zero point 0.2 ratio. Right? PBMs are keeping about zero point 0.8 ratio of them. So that's potentially, we actually just saw in Oklahoma that a $21 million spread that they're missing.
Wow.
Oh.
Some of the PBMs, what you're saying is they keep 80% of the rebates and they pass 20% onto the plan. Wow. Are there any that pass the whole thing on, the whole rebate to the plan?
That's a really difficult question. And the issue is more, can they?
Hmm.
Because what happens is you have GPOs and rebate aggregators and others
Sure.
that collect these rebates and act as an intermediary between.
Hmm.
And so, since we have four primary GPOs across the country, tracking that in, and particularly in my own experience, pharma is a little bit loath to do that. And there are some reasons that we can talk about on another episode. So rebates are good because the definition is that they reach the end user. The
Right.
other manufacturer payments often prefer to be cut in between in pharma's world because they don't influence things like average sales price in Medicare. And so there may be sort of some perverse incentives by both pharma and PBMs to make sure that those don't
Hmm.
actually reach the end user.
Right.
And so when I say it's complicated, that's sort of what I'm hinting at is it's not necessarily nefariousness by some PBMs, and I know some good
Right.
PBMs out there. I also know
Hmm.
that sometimes that contract language is intentionally captured by
Right. Right.
pharma and for reasons that aren't immediately obvious.
Right. And, not too many years ago, Anne, we didn't even think about the PBM piece. We just reviewed the other, if at all. But yeah, the PBMs, that's interesting about the rebates. Employers thinking, well, we're getting rebates. What are you talking about? They must be passed through. But in actual fact, maybe they're only getting 20% of the rebates. Where was it? I saw that number. I think it might have been something you and I were speaking about where 61% of their income was rebates or.
Yes, so that's alleged in another lawsuit.
Mhm.
So that's the Wiederholden versus Assured Partners case.
Wow. So
Yeah.
61% of their total income was rebates. Wow. That's huge. Yeah. So that's, and I've had many episodes on PBMs. This has been great. Do you have just a minute to talk about transparency? I know you're up against a hard stop soon.
Yes, probably just a minute. I am so
Okay.
sorry, but
Sure.
yeah, let's
Yep.
jump in for just a little bit longer.
Okay. So go ahead, lead the way. What do you think about transparency? What does it really mean? What should it mean?
I am probably not going to be super popular about this, but as we see groups like the big three adopting, quote, transparency, I think unfortunately it's really become a marketing term that, makes people feel good,
Right.
but probably doesn't really mean much. And that's really where you do need to look at your contracts and have somebody just saying, like, does transparency translate into action? And then do an audit and see not only is transparency translating into contract language, but then how is that contract actually performing? How much transparency around discounts, rebates, and fees? Super popular topic, right? But
Mhm.
then are you getting spread pricing? Do you have a specialty generic issue? That's a
Right.
favorite topic of mine. And pharmacists are always like, wait a minute, you don't believe in specialty? And I'm like, no, it's not a legal category of medication. You have new biologic, new drug license or abbreviated new drug license, which is a generic. There's not a specialty drug license
Mhm.
through the
Right.
FDA. And then, I think there's also, how much transparency into perhaps other programs. Do you have international sourcing? Hot topic
Mhm.
could go on for ages on that. If that's a thing, you need a lot, like so much transparency because that is a strict liability statute.
Right.
And basically that is and a very complex area of the law.
Hmm.
So be cautious. And so
Right.
again, how much transparency are you actually getting into those? What does it mean? All of
Hmm.
those type of questions.
Yeah, absolutely. And I think that maybe some of the people that say they're transparent, they're getting some things confused between transparency and translucent.
Well, you could argue that in our world, translucent is better. It's a step forward from the opaqueness
Opacity, yeah.
of the beginnings. Yeah, it's not quite ghostly yet, where
Right,
you can
right.
see all the way. We're almost at Halloween.
Yeah,
Let's rally the ghosts and have them be fully transparent.
exactly, exactly. Well, Anne, listen, I know you have to go. It has been a great conversation again, as always, and we'll have you again on the show. And again, we've gotten right to the heart about how trust is built and lost and hugely important. So before we wrap up, how can people connect with you and follow your work? And if they want to learn more, where do they go?
Yeah, so I'm at hcrebelalliance.com, stands for Healthcare Rebel Alliance. You can email me at ann@hcrebelalliance.com or find me on LinkedIn, and that's LinkedIn /in/Ann Lewandowski.
Okay, great. Well, thank you so much for joining us. And for those of you that are listening, if this episode made you think differently about your vendors, your contracts, how you handle employee data, share it with your CFO or your benefits team or friends. Subscribe, like, and share. You can catch every episode on thebenefitwhisper.com or wherever you listen to podcasts. You can reach me, Ralph, at thebenefitwhisper.com or call 832-924-3330. I'm Ralph Weber, and thanks for joining me. And thank you so much for being here today, Anne.
Thank you so much, Ralph. Have a great day.
Thanks, you too.